Hello, welcome to my frequently asked questions. Today I'm talking about non-surgical facelifts. What is a non-surgical facelift? How can it benefit you? And how can we avoid these kind of frustrating, unaesthetic appearances such as chipmunk cheeks, pillow face, flying saucer face? How do we avoid these? So, first of all, what is a non-surgical facelift? Well, it can mean many different things. It can mean fillers and Botox treatments. It can mean skin treatments, including peels and lasers, thread lifts, and then a whole variety of different non-surgical treatments as well. And of course, there are celebrities who've had various treatments, and that can be highlighted intermittently in the media. So, what exactly is it? Well, in terms of that, we also want to know what we want to avoid. And celebrities, this is a picture of Madonna. And Madonna, she has had a fantastic career in pop music, and she's maintained her appearance with the use of cosmetic and plastic surgery. But there have been times in her career where she's been photographed as having a very full face, which has been described as a pillow face. And really, we want to avoid this rather unnatural appearance. Another beautiful woman, Nicole Kidman. She has she has a timeless beauty about her, but there have been occasions where her face just looks slightly warped and has been overfilled, and this has been described as chipmunk cheeks. So how can we avoid these kind of key unaesthetic appearances? And that is one of the main issues with non-surgical facelifts. It's an overfilling or unappealing aesthetic, and all these terms like sunset eyes, duck lips, witch chin, flying saucer face, these are all things which have come across through non-surgical means, and really we want to avoid these appearances because we want to have a natural result where you look the best version of you and avoid these unappealing aesthetics. So what are we going to cover today? We're going to cover what is a non-surgical facelift, what does it actually mean, and to really understand what can benefit you, you really need to understand something about the face and how it ages. Am I a good candidate for a non-surgical facelift? What are the potential options? And there are 5 principal options when it comes to non-surgical facelifting, and I'll talk you through each of these, and I'll show you some before and after images to give you an idea of what can be achieved, what are the potential risks of these treatments, and I'm going to give you a few of my top tips from doing this for a number of years. And of course, we want to avoid issues and we want to have great results from these treatments. My name is Dr. June De Silva. I'm a London-based oculofacial cosmetic and plastic surgeon, and I practice only facial procedures, and I do blepharoplasty, rhinoplasty, facelift, and non-surgical facial treatments for patients every day. So this constitutes information and educational purposes, but it does not constitute a medical consultation. First of all, what is a non-surgical facelift? I've really broken this into 5 key elements, and I'm going to talk you through each of these. There's Botox treatments, which can be for certain lines and wrinkles, filler treatments, treatments that focus on the skin, thread lift techniques, and then a whole variety of non-surgical machines. So, to understand which treatments are going to benefit you most, you really need to have some idea of what is facial aging and what happens in facial aging. And really the elements that change are the quality of your skin thins. You tend to lose a certain amount of volume from the face. Natural fat tends to gradually dissolve. And there's certain things that can exaggerate that. If you do a lot of aerobic exercise and running, that will tend to dissolve your volume, your fat, faster. Skin quality, the skin changes with time. It gets more lines, more wrinkles, more fine lines with smiling. The effects of gravity. All of us are fighting against gravity, and parts of the face generally tend to come down with time, and that tends to give you more fullness in the jawline, and it turns what can be a very V-shaped jawline in your 20s and 30s to a squarer jawline as you get older, as part of the face droops down with gravity. And then the skin gets looser. The elastic properties of the skin that are very elastic when you're 20 and 30, they gradually soften and the skin becomes more stretchy and doesn't spring back to how it used to be. And then the elements that can affect this, well, aging, of course, these things can deteriorate, but then the other factors are genetics and lifestyle. And by genetics, well, I picked out a few elements, but there are many others as well. In your 30s, some patients will find that they actually have a lot of loose skin even at that point. And one of the factors that can affect that is hypermobility. Now, if you can bend your thumb all the way back to your wrist, which some people can do, and I can only really bend it to 90 degrees. Well, if you can bend it all the way down, you really have hypermobility, and that's something that you've inherited from your parents. Well, it tends to give you more loose skin at a younger age. In women, early menopause and the change in hormones, well, for some women that can facilitate increased aging. And then your underlying genetics and bone structure. If you have a small chin, for example, well, often the small chin means that everything under the neck is concertinaed back into a smaller space, and often you have more fullness. And I certainly have some patients who have hated their neck even since their 20s, and often that's a genetic element such as a small chin. There are absolutely other genetic elements, but I picked out a few that are quite clear. Now, there's also lifestyle issues. Now, if you love going in the sun and having sun exposure, well, that tends to age and wear your skin faster. It gives you sun damage and sunspots and pigmentation, as well as being risk for other more serious issues such as skin cancers. Smoking, well, I've had many patients over the years who smoked for a number of years and then suddenly found that the aging process accelerated, and it reduces the skin quality, the elasticity, and generally ages the skin faster. And then other factors, if you lose suddenly a lot of weight, well, suddenly you can find that volume changes in your neck, and you can find you have more loose skin. So am I a good candidate for a non-surgical facelift? Well, the 5 elements that can really be treated with non-surgical treatments include lines associated with smiling. Botox can be very effective at treating those lines, and I'm going to show you some examples in a moment. Volume loss, well, if you've lost volume in specific areas, fillers can be used to restore that volume loss. Fine changes in the skin quality, like fine lines, pore size, well, forms of skin resurfacing, including peels, lasers, and there are others such as regenerative medicine and platelet-rich plasma, PRP, well, these can improve the quality of your skin. Temporary lifting can be achieved with threads, and I say temporary because in a way they only last for a period of months before their effect tends to wear off. And then finally, well, if you have mild loose skin, there are a variety of machines that can tighten skin. However, we'll talk about the variety of those treatments and how they can benefit you. So, first of all, what are the limitations? What is the limitation where non-surgical facelift really is not going to achieve things, and really there are some patients that are going to benefit more from surgery? Well, it's really these 3 elements. If you have quite a lot of effects of gravity, and you have a lot of jowls and deep nasolabial lines, deep folds going from your nose down to your lips, well, this is going to be something that's quite hard to restore non-surgically, because if you have to add a lot of volume to the face to improve these things, it's not going to look natural. If you have a lot of loose skin, if you can pinch more than 1 centimeter of loose skin, well, it's pushing the boundaries to what these kind of non-surgical treatments can achieve. And then finally, volume. Filler and non-surgical treatments is very good for very specific areas, but if you've lost a lot of volume just all around your face, well, often fat transfer will be more preferable. So what are the options when it comes to non-surgical treatments? Well, it really breaks down into these 5 areas. Number 1 is Botox, number 2 is fillers, number 3 is skin treatments, number 4 are threads, and number 5, non-surgical machines. And we're going to talk through each of these. So the first one of 5, Botox. Well, if you have lots of these kind of forehead lines, these are dynamic lines associated with movement, Well, Botox can really treat these lines very effectively and reduce those movements. Now, it's not going to be suitable for everyone, because if you have low brows, which some women have and many men have, you have to be quite cautious about Botox in the forehead, because everything can drop a millimeter or so, but otherwise it can be a very effective treatment for this area. Crow's feet. Well, crow's feet exist in the corner of the eyes, particularly when you smile, and this is often something that comes with natural aging. And Botox can very effectively treat these lines and reduce that movement and improve that appearance. And then thirdly, the common area with Botox that can help is this area between the brows. Now, in medical jargon, this is called the glabella area, but often we call them the number 11s, because often there's a pair of ones in this area. And Botox can effectively treat this area. And in the past, other treatments have also been used in this area, but other treatments such as fillers, well, it can be quite a hazardous area to do fillers, because it's like a danger zone in the face with blood vessels. But Botox can work very well in this area. Filler treatments. Well, filler treatments mean adding a gel. Often these are made out of a substance called hyaluronic acid, which exists naturally in the skin and in joints. And hyaluronic acid, well, it is a substance that is soft and clear, and it can be used to rejuvenate the face where you've lost volume. So particularly patients who've got flattening of the cheeks, volume loss, some folds or shadows. Well, in this patient of mine, I've added some volume along the zygomatic arch, the cheek area. There's a point called the beautification point, where almost every woman, if you add volume, it creates more of a curve called the Auger curve that looks more feminine and attractive. And then small amounts of filler put in the shadows, what's called the nasolabial fold and marionettes, and along the jawline and angle of the jaw. Well, fillers put in these kind of areas, and that's in the form of a non-surgical facelift. Well, it can really rejuvenate a person's face and freshen their appearance up. And this is another patient who's also had a similar treatment, and you can see how there's just more volume in this area, and it's just softened the lines and shadows and just freshened up her appearance. So thirdly, we move on to skin treatments. Now, common things are like fine lines around the mouth, and these treatments, fine lines around the mouth, fine lines in the skin generally, and really skin resurfacing, which can be in the form of peels, it can be the form of laser resurfacing, which I would regard as the gold standard when it comes to skin resurfacing. Well, these treatments can smoothen out some of these fine lines and wrinkles, and lasers, for instance, they work by stimulating collagen in the skin, and different machines can work on different levels of the skin. The laser machine that I have has a setting that will work on the superficial skin, and then a second setting on the laser that will tighten the deeper skin, like deeper pores, deeper lines. And so these treatments, well, they can really be used to polish the skin, reduce fine lines, and improve wrinkles that are there after time. And it's another patient with these kind of fine lines in the skin. And so laser has just polished that skin and just made it smoother and more even. Thread lifting. Well, thread lifting is often quite heavily marketed in the media, and it can be used by non-surgical clinicians to lift the areas of the face. However, it is only really suitable for quite mild aging, and it is temporary. It only lasts for a period of months, and is not suitable for all patients, because particularly if you have thinner skin, well, you can see these tiny little threads and it can create irregularity. But in some patients, such as this patient, it can really freshen up the face, because it can just rejuvenate by just lifting small amounts in patients who don't really need a surgical treatment, but they just need a mild amount of lifting. Or if you have a very important event in a few weeks' time and you just want something to freshen your appearance up, well, threads could be used as an alternative to surgery, because surgery obviously would have more recovery. And then finally, the use of machines. And there are a variety of different machines that use different technology. Some use radio frequency, some use ultrasound, some use, and there are other forms as well. And these tend to work in similar ways by tightening the skin. And I'm going to talk about this further, but in a way, expectations are important when it comes to these non-surgical machines, because although they have an effect, often they're quite conservative and the effects are quite mild. And this is a patient that I took from the media, Judy Murray, who had a non-surgical treatment with radio frequency, and she looked much fresher afterwards, but you can see there's quite a difference in the lighting, and much brighter light has been used, and so has already covered and masked some of the shadows in her treatment. This is a patient of mine where I used radio frequency in a gentleman to tighten the skin after completing liposuction in the neck, and you can see how it's tightened the skin under this area, under the jawline, giving him more definition. Having said this, there are some important risks associated with non-surgical treatments, and the most serious issues are damage to the skin caused by blockage of a blood vessel, and that's termed skin necrosis, and scarring, either from the similar techniques or scarring that's associated with the use of non-surgical machines. The other most serious thing to consider is damage to vision, which is associated with blindness, and that's a very rare complication caused by damage to the blood vessels caused by filler injections around the eyes. So let me talk you through some of the specific risks associated with non-surgical treatments. So Botox generally is a very safe treatment that's been used for many decades now, but very occasionally it can affect the wrong muscles. It can result in ptosis, like a droopy eyelid on this patient's eye, and this is only temporary and it will wear off, but it's something that of course is frustrating because it will last for a period of weeks. So then what about filler treatments? Well, a common issue with filler treatments is puffiness, and puffiness around the eyes, puffiness around the cheeks. Not only can it look unnatural, well, it can look somewhat strange because it doesn't look quite right. And often it can be a bit of an experience treating these patients because it means dissolving all the existing filler and then treating with a surgical equivalent, which might be blepharoplasty, might include fat transfer. This is a patient of mine who unfortunately had all this puffiness around her eyes as well as other areas of her face after filler treatments, and she saw many clinicians before seeing myself who were unsure how to treat this. Ultimately, we needed to dissolve all the filler. You can see once the filler was dissolved, it unmasked this kind of shadowing and natural aging around her eyes. And then I treated that with a combination of blepharoplasty and fat transfer, and that gave a very nice result. Now, skin treatments generally are very effective at polishing the skin and improving fine lines, and there can be a recovery with these treatments that results in a pinkness of the skin. And this is a patient who has some erythema in the skin resulting from laser around the mouth. Now this will completely improve with time, but it can take a period of weeks for that to improve. Laser treatments, skin peels, well, they should be done by a clinician who's experienced, because different skin types will respond differently to different treatments, and some will be quite suitable for some patients, but ethnicity can play an important role, and there are some treatments that are best avoided in certain ethnicities. Thread lifting. Well, thread lifting has been marketed a lot in the media, but it is associated with issues, and this was taken from ITV morning show where a celebrity had a thread lifting technique around his eyes, and it resulted in complication and damage to the skin and scarring. And so this non-surgical treatments, which can be effective when done correctly, well, in some patients they can lead to issues. And then finally, the use of machines. And there are a whole variety of different machines which have had different issues associated with them. I would say the number one issue with these machines is many patients come to see me having been treated elsewhere, where they've just found there's not been much of a result, not much of a skin tightening or not much of an improvement. And although the machines can be effective, if you have centimeters of loose skin, there's no machines that can yet tighten centimeters of loose skin. They work more in millimeters. And so there are some patients that really are going to benefit more from a surgical procedure such as a facelift or a mini facelift, and really trying to tighten the skin with radio frequency or ultrasound, it just is not going to do quite enough. There have unfortunately been other issues with these non-surgical machines, and this is an image I took from Facebook where a patient has been left with a lot of dissolving of her natural fat after an ultrasound treatment. And of course, these machines, although they can be very effective, they can also cause damage to the underlying structure. So they need to be used with great, in a conservative way and by experienced professionals in order to make sure that they're done correctly. So finally, my tips in terms of non-surgical facelifts, well, it is not a true facelift. Although this terminology has been used a lot in marketing, a non-surgical facelift, it really isn't a facelift because it's really doing significantly less in terms of it can't lift the face in the same way. It's either tightening or adding volume, but lifting is something that's quite difficult to do without surgery. Often, to get the very best results, you need a combination of all these treatments. There isn't one single treatment that you can have, Botox or fillers, that will just universally treat the aspects of aging. You often need a combination to get the very best results. Non-surgical machines, well, although they're kind of advertised and marketed as non-surgical, often there is some recovery involved. And even the lighter treatments, often there will be some degree of swelling and a potential for bruising, and so they are a little bit more than a non-surgical treatment. And I think you need to have realistic expectations when it comes to these machines, because although they can tighten millimeters, they cannot tighten centimeters. And then the non-surgical treatments, although the idea and principle is good because the idea of surgery seems to carry more risks, there are undoubtedly risks associated with non-surgical treatments, as I've shown you. The number one would be unaesthetic results, which could be a combination of overfilling or over-treatments. Secondly, there could be scarring of the skin, and scarring of the skin from is a complication associated with some of these non-surgical treatments that I've mentioned to you today. And blindness. Blindness, although very rare, is associated with filler treatments, and of course that's a very, very significant risk event. Finally, I would say it's important to see an expert who does a lot of non-surgical treatments, and there is definitely a degree of art and aesthetic to this, and less is often more. You don't want to add a lot of volume to the face because it will start to give some of those characteristics that we looked at the beginning that some celebrities have had in the past. Pillow face, Nicole Kidman, who had like too much volume in her face from filler treatments. Well, it's better to have a little less treatment, and that is the degree of art in terms of how these treatments are done. So what have we covered today? Well, we've covered what is a non-surgical treatment, how does your face age, and what potential factors could make you a good candidate for a non-surgical facelift, and what candidates are going to be better suited towards a surgical facelift. What does a non-surgical facelift mean? I've taken you through the five elements that make that up. I showed you some before and after cases. We talked about the potential risks of some of these treatments, and I gave you some of my top tips. So I do hope this information has been helpful for you. If you have any further thoughts or questions, please don't hesitate to contact me either through my website and email or through social media. Thank you for watching.